mynews.studio.
A kidney has been transplanted for the first time on Maldivian soil. What does that really mean for a country that's always relied on getting this care abroad?
Today is October 21st, 2025. The Maldives has just completed its very first local kidney transplant. But before this, if someone in the Maldives needed a new kidney, what options did they actually have?
Only one option, really. Travel overseas, most often to India or Sri Lanka. While the national health insurance, Asanda, would cover some expenses, patients still faced enormous challenges, arranging international travel, time away from home and family, losing income, and the stress of being far from their support network at such a vulnerable time.
That's a huge hurdle. The Maldives has made good progress in areas like maternal and child health, though. Why was organ transplantation out of reach for so long?
It came down to both technical and structural challenges. Transplants need specialized infrastructure, clear laws, and highly trained teams. For a country made up of so many small islands, bringing all those elements together was a major undertaking.
So, what was the catalyst? What changed to make this first transplant possible?
In October 2025, the government put forward the Human Organ Transplantation Bill in Parliament. This bill spells out strict guidelines. Only voluntary donations from adults, the creation of 2 oversight bodies, and heavy penalties for things like organ trafficking.
2 oversight bodies. Can you clarify how they'll work?
Of course. There's a 9-member Organ Transplant Council which will oversee the entire transplant system. Then there's a 5-member Authorization Committee which reviews and approves each transplant case individually. Both are designed to ensure everything stays ethical and transparent.
What about the hospitals? Passing laws is one thing, but were the facilities actually ready to handle transplants?
This year's budget is funding 5 new hospitals, including a dedicated thalassemia and organ transplant hospital in Hulhumale. Operating theaters are being upgraded to meet international standards, and there's a plan to decentralize care so people outside Male can also access these services.
But expertise can't be built overnight. How are they addressing the skills gap among local clinicians?
International partnerships have played a key role. Foreign experts helped draft the law and provided hands-on training for Maldivian doctors and nurses. There's also an emphasis on fellowships abroad, especially for nephrologists and surgeons, and they're setting up a national renal registry to improve patient tracking.
It sounds very comprehensive. Still, safeguards are critical. How is the new law preventing abuses like organ trafficking or coercion?
Only adults of sound mind can donate, and only if it's voluntary. The law strictly forbids the sale or purchase of organs, and oversight as well as quality control are built in. Violations carry serious penalties.
Looking forward, once the law is fully in place and the system is running, what will this mean for patients?
For the first time, patients will be able to undergo transplants without leaving the Maldives. That translates to lower costs, less stress, and crucially, the support of family during treatment. It's a fundamental change, emotionally, financially, and medically.
Do you think this approach could be adapted by other small island nations or developing countries?
That's the intention. The Maldives is demonstrating that with targeted investment and international collaboration, even a small nation can develop advanced medical services. It could serve as a template for other countries facing similar resource and geographic constraints.
So this isn't just a Maldivian story. It's a case study in closing healthcare gaps worldwide?
Exactly. It suggests that healthcare equity is achievable with the right strategy, partnerships, and ongoing commitment.
So, to sum up, the Maldives has gone from relying completely on foreign transplants to launching its own program, thanks to legislative changes, investment in infrastructure, and international cooperation. The ripple effect could extend far beyond its borders.
And for Maldivian patients, it's more than just a policy milestone. It's the chance to receive life-saving care closer to home.
Thanks for tuning in. This episode was brought to you by mynews.studio. You can try it now for free.